Anita from Ahmedabad asks, Doctor, if I felt a small lump in my breast last week while showering and I have not been able to sleep properly since, should I panic? Is this definitely cancer? A breast lump can happen because of many reasons, and most of them are not cancer at all. In younger women, the common cause includes conditions like fibroadenoma, cyst, or simple period related breast changes. In breastfeeding women, it can be blocked milk ducts or a breast abscess. In women above 35 or 40, doctors become more cautious because the chance of cancer does increase with the age. But even then, many lumps turns out to be benign. The simple rule is that if the lump is new, persistent, growing, hard, fixed in a place, or if it is associated with a nipple discharge, skin dimpling, nipple pulling inwards, or a lump in your armpit, then please get it checked properly. Waiting for months because maybe it will go away on its own is where many women lose valuable time. So please get it evaluated this week, not next month. Pooja from Nashik says the doctor had told me I have a small lump that need to be checked properly, but my mother-in-law and aunt are already telling me that if there is a lump, there will be definitely a surgery. Is that true? Will I definitely need an operation? Not every breast lump needs surgery. If it turns out to be a simple cyst, sometimes it may only need observation or aspiration. If it is small fibroadenoma that is not growing, the doctor may simply monitor it over time. If the lump is large, painful, increasing in size, causing you anxiety, or remain uncertain on the test, then yes, it may need to be removed surgically. If it is an abscess, especially in breastfeeding women, it may need drainage along with medicines. And if it turns out to be cancer, then surgery becomes a major part of the treatment. But the exact type of surgery depends on the stage, the size, the location, and what you as a patient prefer. So Pooja, breast lump does not automatically means major surgery. The test results decide the next step, not the family's prediction. Sunita from Coimbatore says, Doctor, I am terrified after my biopsy because they have told me it is cancer. Now my husband and I are reading online and getting scared that they will remove my whole breast. Is that always the case with breast cancer surgeries? Many women believe that a breast cancer diagnosis automatically means complete breast removal, but this is not the case. Many patients are actually eligible for what we call as breast conserving surgery, where only the tumor and a small margin of healthy tissue around it is removed, and then additional treatment like radiation is given when it is required. In some cases, mastectomy, which is removal of the breast, may be needed. For example, if the tumor is very large compared to the size of your breast, if there are multiple areas of disease, or if you have specific risk factor. Your doctor may also check the lymph nodes in your armpit through something called a sentinel lymph node biopsy or axillary surgery, because breast cancer can sometimes spread through these lymph nodes. So the final plan is personalized for you, and please do not let online forums decide what your surgery will look like before your own doctors has explained it to you. Lakshmi from Mysore says, Doctor, my husband and my elders are refusing to let me go ahead with the biopsy. They keep saying that once the needle goes into the lump, the cancer will spread to the rest of the body. Is this true? I am genuinely confused now. The answer is clear no. A proper performed biopsy does not spread cancer. In fact, the biopsy is a test that actually tells your doctor whether the lump is benign or malignant in the first place and exactly what treatment you will be needing. Avoiding the biopsy because of this fear only delays the diagnosis. And with breast cancer, early diagnosis is what makes treatment simpler and outcome is far better. Geeta from Bhopal says, I am 32 years old, no family history of cancer, and I feel my breasts are generally lumpy anyways. Are there any specific warning signs I should never ignore even at my age? Yes, and please remember these because they apply to women of every age, including yours. Please see a doctor if you notice any of the following: a new lump in the breast or armpit, nipple discharge, especially if it is bloody, a nipple that has suddenly started pulling inwards, dimpling or thickening of the skin, redness or swelling, skin that starts looking like a peel of an orange, a lump that is growing or one that has not gone after your next periods, or any breast changes that appears after menopause. Because Geeta, if you are young, even if there is no family history in your family, and even if the lump is completely painless, please get it checked. So if you have felt a new lump, a swelling, a change in your nipple, or anything in your breast that feels different from your normal, then please do not guess. Find a breast surgeon, surgical oncologist, gynecologist on Practo and use the female specialist filter if this is your concern. And if this video has helped you, subscribe to Practo for her and hit the bell icon.